कौन सा मोड चल रहा है अभी अपना? वर्बल। ठीक है, आपस में भी अभी आप लोग वर्बल पे हैं, और कोई बहुत इंटेलिजेंट पर्सन होंगे जो दोनों मोड पे होंगे, बिकॉज दे माइट बी राइटिंग एज वेल एज दे माइट बी लिसनिंग, ओके, एंड प्लस एडिशनल दे माइट बी गिविंग देयर ओन कमेंट्स, ओके, in their notebook. So number of receptors, number of transmitters, number of interconnections are working for the final result. Okay, language function depends on one cerebral hemisphere than other. Okay, dominant hemisphere. So in case of right-handed person, it is the left hemisphere. Okay, in 95% of the right-handed persons, left hemisphere is dominant. In 70% of the left-handed person, left hemisphere is dominant in case of language and speech. Okay, so 95% of the population have left cerebral dominance. It is also known as categorical hemisphere. Okay, you get an MCQ about this categorical hemisphere. The main areas which are responsible for this language and speech. Okay, if we want to have speech or language, okay, verbal or written. So when we are talking of verbal speech, okay, what is the most important requirement to have a normal speech? What is the most important requirement to have a normal speech? Tongue palate. To have a normal speech, you should have an intact auditory pathway. Unless you are going to hear. So for hearing, what you need to have a ear auditory pathway. So the first important requirement is the intact auditory pathway. Until unless the person hears, उसके बाद ही अंदर की processing होगी. Okay, so it is most important area thing required for speech is the intact auditory pathway. If we are going for written speech, what is the requirement? So the important is visual pathway, intact visual pathway, that is the requirement for the written speech. When these two things, okay, they reach to that area, okay, when they reach to their permanent areas, there the further processing takes place, and the information from the auditory cortex or the visual cortex, they goes to the secondary assessment accessory areas. From there it will go to the vernix areas. Vernix area will project the information to the Broca's area. Broca's area, okay, will project and take the help of motor cortex and will be resulting into either the verbal speech or the written speech. Okay, so you get a good question on this particular aspect of speech, that is verbal or written. ठीक है, आज की क्लास के बाद में पता चल जाएगा आपका कौन सा स्पीच एरिया डोमिनेंट है, वर्बल या रिटन, है ना? फीडबैक लेंगे तो पता चल जाएगा कि कौन सा एरिया डोमिनेंट है. So the definition, speech may be defined as a means of communication between two individuals or group of individuals. Come first. Now, means of communication may be sensory and motor. For the any response or reflex, you need two important components. That is where the stimulus, that is the receptive area, and another is the motor area. So the two important sensory input area related to speech are सेंसरी की बात कर रहे हैं हम, auditory cortex and visual cortex. Okay, it is auditory, it is present in the temporal region, and the visual, it is present in the occipital lobe. So these are the two important sensory areas. There, along with their secondary associated areas, the information will be integrated, comprehended, okay, analyzed. आपने कोई वर्ड पढ़ा या आपने कोई वर्ड सुना, ठीक है, तो उसके बाद की जो प्रोसेसिंग होती है वो उन ऑडिटरी एरियाज या विजुअल एरियाज के एसोसिएटेड एरियाज के हेल्प से होती है. ठीक है, अगर ये ऑडिटरी एरिया है तो इसके पास में होगा सबसे नियर बाय इज वर्निक्स एरिया. ओके, and if it is the visual, okay, it is the visual associated area and that is known as डिजिनस एरिया. ओके, तो इनके नंबर है, इनकी न्यूमरोलॉजी है, रोमन नंबर से इनको क्लासिफाई किया है. इसको अभी अपन चेन्स में या फ्लो चार्ट में देखेंगे. ओके, सो यू गेट अ क्वेश्चन, सो इट इज टू मेक यू अंडरस्टैंड इन अ सिंप्लीफाइड मैनर अकॉर्डिंग टू फिजियोलॉजी. Okay, so two important sensory regions are what? The auditory and the visual cortex present in the temporal and the occipital lobe. When we are talking of the motor area, what are the motor areas? It is the Broca's area, and this Broca's area, okay, 41-42 is responsible for speaking, okay, or writing. So speaking के लिए आपको क्या important requirement है? If you want to say something, what are the muscles involved? Tongue, lips, larynx, vocal cord. So you need to have a fine coordination of all these things that will result into particular type of speak or the speech. Okay. When we are writing something, what is the requirement? If you want to write something, पेंसिल भी दे सकते हैं. इट इज नॉट ऑलवेज कि आपको पेन से ही आंसर लिखना है ना. स्लेट से, पेन, उससे भी, चौक से भी लिखते हैं लोग, बाग मिट्टी पे भी लिखते हैं. तो ये आंसर देना तो बहुत ही यूजलेस है कि पेन रिक्वायरमेंट है. सोचो तो अच्छा सोचो, ये क्या लोग बात चंद्रयान पे पहुंच गए, तुम ऐसी फालतू बात सोचते हो. व्हाट इज द रिक्वायरमेंट? शौर्य, थोड़ा सा इसको एक्टिव करते हैं. हाँ, if you have to write in your exam, okay, so what is the most important thing that you require? You need not to use your fingers, your hand. आपका कोऑर्डिनेशन नहीं चाहिए आपके फिंगर्स के फाइन मूवमेंट्स के लिए. या आपने पेन को कह दिया कि पेन लिखो तो पेन लिख देगा? तुम्हें ज्यादा आ रहा है तो तुम आके थ्योरी समझा देना. आए कैसे बच्चे क्लास में? So sensory communication is auditory communication and visual communication. Motor communication is power of talking and writing. Okay, this is the area which we'll see that what are the main areas which are responsible for language and speech, and together these areas, they are known as language zones. Okay, all the parts which are responsible for language and speech together, when we are talking of these areas, these parts, it is known as language zone. Okay, so most important, auditory area. Okay, when we are talking of verbal speech. Okay, then associated is occipital lobe, we have the visual area. Okay, this is general interpretive area. कौन सा नाम होगा इसका? वर्निक्स एरिया. जो वर्ड्स को कॉम्प्रीहेंड करेगा, उसको एनालाइज करेगा, उसको यूज करने की एप्लीकेशंस लगाएगा. ठीक है, वर्निक्स एरिया ने कॉम्प्रीहेंड कर दिया, वर्ड्स को सुन लिया, देख लिया, ऑक्सिपिटल रीजन से भी इंफॉर्मेशन आ गई. ठीक है, ऑडिटरी कॉर्टेक्स से भी आ गई, ऑडिटरी एसोसिएटेड एरिया से भी आ गई, विजुअल एसोसिएटेड एरिया से भी आ गई. फाइनली द वर्निक्स एरिया इज comprehending the words. Okay, it is catching, it is analyzing. Now till vernix area, it is the sensory area. So if the lesion takes place in either of these areas, okay, what will happen? The patient will not be able, he is listening, the auditory pathway is intact, The visual pathway is intact. He can see, he can hear. Okay, but what he cannot do is comprehend. It cannot be analyzed. उसका कोई मीनिंग नहीं बना पाएंगे. ठीक है, ऑडिटरी पाथवे भी इंटेक्ट है, विजुअल पाथवे भी इंटेक्ट है, देख भी पा रहे हैं, सुन भी पा रहे हैं. बट इफ देयर इज अ लीजन इन द सेंसरी area of the language zone, what will happen? The person will not be able to comprehend the vocabulary or the words which are spoken or written. So there will be a different type of disorder. Okay, disorder in language and speech. Now this sensory information has to be carried to the motor areas. Okay, so they are carried from the vernix area to the Broca's area through a nerve fibers connection. Okay, and there with the help of motor cortex area, if it has to be a verbal speech, okay, there will be a coordination of lips, tongue, vocal cords, and the spoken speech will be there. If it has to be written, it will take the help of exner's area, and this will be responsible for writing speech or writing work. जब अपन writing की बात करते हैं तो exner's area specially present near the Broca's area is responsible for controlling the motor cortex area, which are responsible for fine coordination of finger and hand movements for writing. If there is lesion in that particular area of language zone, that is the motor area, what will happen? The person is able to hear, comprehend, okay, but is not able to give a output, will not be able to speak. If the person is able to speak, it will not make that much sense. So there will be problem in output activity. The person will not be able to write, or the person may not able to speak. So speech, written or verbal, two types. Okay. For that, the most important requirement is intact auditory and visual pathway. Okay. That information is going to where? So these are the main areas. Okay. Language comprehension or intelligence. Okay. This is the vernix area. From here the information will go. Now we'll see the chain. Okay. This is the graphical flowchart type of representation. Primary auditory areas, auditory interpretive area, visual interpretive areas, somatic interpretive areas, and they are going again into the. So this is arcuate fasciculus, which is responsible for sending information from the sensory zone to the motor zone of language zone. Language zone को हमने दो में divide कर दिया, sensory और motor. Sensory और motor को communicate क्या कर रहा है? Arcuate fasciculus. Okay. So if there is a lesion in arcuate fasciculus, what will happen? If there is a lesion prior to arcuate fasciculus, that is prior to the vernix area, what will happen? If there is a lesion behind the arcuate fasciculus, what will happen, or what type of disorder will take place? Okay. This is Dijner's area, which is mainly associated with the visual or written speech. Okay. So primary visual cortex area 17, high visual cortical area 18, angular gyrus, most important part played by this in the written speech. Vernix area के पास में ले जाएगा, project करेगा, and vernix area will project to the 44 area, that is Broca's area, and with the help of coordination it will be done. This is the speech chain. Okay, the listener, the speaker. Okay, when some speaker is speaking something, this is the auditory pathway which has to be intact. Okay, it will go to the through the sensory nerves. Okay, sound waves travel ear and sensory nerves, brain and the listener, and this is the chain which can be seen. Okay, auditory ये सब हो गया अपना. Okay, aphasia or dysphasia. What do you mean by aphasia? Abnormalities of language functions that are not due to the defect of vision or hearing. So, deafness is something different and aphasia is different. डेफनेस किस वजह से होगी? The definition itself says the abnormalities of language functions that are not due to defect of vision or hearing or to motor paralysis. Okay, so deafness is when the ear is not able to hear. The deafness may be conjunctive deafness or the sensorineural deafness. That is something different. Okay, but aphasia is when the intact, that is the auditory and visual pathways, they are intact. Okay, but still the person is not able to speak or write. Okay, so that is known as aphasia or dysphasia, difficulty in speech. Okay, that may be verbal or that may be written. Okay, due to cause may be due to the defect or the lesion in the categorical hemisphere, that is the dominant hemisphere. Okay, and the classification of their symptoms or their features. What are the features that will say that this particular type of aphasia or dysphasia is seen in which type of patient? So if there is sensory aphasia, okay, so the problem lies in the sensory region of the language zone, that is till the vernix area. Clear? If it is motor aphasia, that means there is lesion in the Broca's area or the motor associated areas which are responsible for verbal or written speech. So that will result into motor aphasia, dysphasia. Global aphasia, that means it is involving both the sensory zone as well as the motor zone. So it becomes global aphasia. Clear? So aphasia is difficulty in language, okay, language and speech, maybe verbal, maybe written, okay. When we are talking of aphasia, it may be categorized for simplicity into three different main areas, that is sensory, motor and global. When we are talking of sensory aphasia, it is mainly due to the lesion in what areas? The sensory areas of language zone or the receptive area. Another term for sensory is receptive. You are receiving the information either through a special senses, that is ear or eye. So they are the receptive areas. So receptive aphasia. Another important is motor aphasia. And third is which type of aphasia? Global aphasia involving both the areas sensory and motor. That becomes the global aphasia. Okay. Now with the help of these words, we can see the symptoms and categorize according to it. Okay. Fluent, non-fluent, anomic. Okay. So further classification, you can see aphasia may be expressive, receptive. Okay. Non-fluent, understanding the normal, but voice production is defective. Okay. Understanding normal means till the vernix area it is normal. Hear or see. Okay. But non-fluent means it cannot repeat. Okay. So understanding normal, but voice production is defective. Fluent, meaningless words. ठीक है, इस तरह के वर्ड्स बोलना जिनका कोई मीनिंग नहीं हो, रिपीटेट करना, फ्लुएंटली बोलते रहना, पर उसका कोई मीनिंग नहीं निकलना, एक अपने ही शब्द जाल में नहीं रह जाते हैं, रिपीट कर रहे हैं, मतलब कोई मतलब नहीं उस चीज का उस तरह से. सो मीनिंगलेस वर्ड्स विद loss of comprehension and understanding. So that means there is problem in vernix area because that was responsible for comprehending, understanding, interpretation. Okay, so that area has some problem. So the person is not able to have comprehension or understanding and meaningless words get repeated. So fluent. Okay, anomic, unable to name the object. He can identify the object, but he is unable to name the object. Okay. If it is non-fluent, which area? Broca's area. If it is this meaningless word, the area affected is vernix area. Okay, anomic, it is angular gyrus, okay, present near to the occipital lobe, and global, that is mixture of all, widespread damage to the speech area or the language zone. This is the simplest classification of aphasia we can give. Okay, इसको अपन सेंसरी, मोटर और ग्लोबल में भी कैटेगराइज कर सकते हैं. ये कौन सा हो गया हमारा? motor aphasia, because it is affecting what area? Broca's area, and Broca area is responsible for motor activities. Wernicke's area, sensory aphasia. And if both are involved, it is global aphasia. Okay, auditory association areas, word deafness. ओके, ऑडिटरी एसोसिएशन एरियाज अगर हैं, ठीक है, तो क्या होगा? एक वर्ड डेफनेस है, वर्ड ब्लाइंडनेस वर्ड है, ठीक है, तो ये चीजें कब होगी? वर्ड ब्लाइंडनेस व्हेन देयर इज प्रॉब्लम इन द डिजर्न्स एरिया, व्हेन देयर इज प्रॉब्लम इन द ऑडिटरी एसोसिएशन एरिया, इट इज वर्ड डेफनेस. विजुअल एसोसिएशन एरिया, वर्ड ब्लाइंडनेस फॉर डिस्लेक्सिया. Wernicke's aphasia, unable to interpret the thoughts. Broca area causes motor aphasia. Global aphasia, unable to interpret the thoughts or motor aphasia. इसका क्या एग्जाम्पल है सबसे बेस्ट? सही बोले थे? कौन बोला था? In Indian population, the best mean to explain something is by Bollywood. है ना? The mass, the mainstream of Indian population, okay, their main hero or their main heroine are the Bollywood hero heroines. Okay, they only have that much of IQ, so they can see that much only. Okay. अभी कौन साइंटिस्ट चंद्रयान के लिए रिस्पॉन्सिबल थी? फीमेल मेन साइंटिस्ट. इसरो का चीफ. तुम खुद अपनी कम्युनिटी के लिए हंस रहे हो? ओके, सो डिस्लेक्सिया, another common, another main hero of Bollywood stream who had dyslexia. Tare Zameen was a movie. Okay, I am talking about some Bollywood star who had dyslexia. Abhishek Bachchan. Okay, so these are the different type of aphasias or dysphasias. If it is lesion in the Wernicke's area, what will the features? Speech is normal. Okay, sometimes patient talks excessively, means fluency. Okay, full of jargons and neologism. Okay, what are jargons? What do you mean by jargons? These are the features which are seen if there is some lesion in the Wernicke's area. Too many of words. अपने ही शब्द जाल जो होते हैं ना, मतलब बहुत ज्यादा वर्ड्स को यूज करना, बट उसको पता नहीं कि वो क्या यूज कर रहे हैं. नए नए वर्ड्स बनाना, बट जिनका कोई मीनिंग नहीं होता. ठीक, सो full of jargons and neologism with little sense. Patient fails to comprehend the meaning of spoken or written words, and motor part of the speech or the person is normal. Okay. Conduction aphasia, fluent aphasia. Patient can speak relatively well and have good auditory understanding, but cannot put words together or conjure up words. He can hear, okay, but cannot put words together in a sensible sentence due to lesion in and around auditory cortex. Okay, in angular gyrus, it is the written or the words which your person is seeing. These are the different disorders of language and speech. Clear? So, with this, we complete our lecture for you. Okay? क्या time हो गया? Okay. So, ready for attendance?